people who think the government is God, and gentlemen. This is the third and probably final part in my series on government inefficiency. Point being, when one gets the government more involved in X, prices usually rise and money is wasted through inefficiency, corruption, and rent seeking. I am not stumping for an end to the federal government, simply a massive downsizing and a return to the founders' intentions pertaining to the role of the federal government in our Constitution. If you've watched the previous two videos, I need not say any more. Let's get down to brass tacks. Weeks after a government audit revealed that the IRS doled out $33 million in fraudulent electric car tax credits, a separate probe says the agency paid out over $500 million to home buyers who didn't qualify. Last March, the Treasury Inspector General, the IRS's watchdog, found that the Hussein Obama administration's aggressive push to reward consumers who buy costly advanced technology vehicles, and they are costly, resulted in rampant corruption because claims were automatically granted without scrutiny. No. In many cases, the lucrative tax credit, funded with your money of course, worth up to $7,500, was awarded to gas-guzzling sports utility vehicles and even a bicycle. Some people got multiple tax cuts for the same vehicle, or tax credits I should say. The article said cuts, it should be credits. Some people got multiple tax credits for the same vehicle, and dozens of prisoners, like Jack, received nearly $50,000 in alternative vehicle credits even though they were behind bars. Oh, I'm sorry, Jack's not behind bars anymore. He's running freely, unfortunately. This month's audit du jour says the IRS has dished out more than $513 million in credits to unscrupulous filers who claim first-time home buyer exemptions of up to $8,000 as part of Hussein Obama's disastrous stimulus plan, and it is a disaster. A chunk of the money, about $326 million, went to nearly 50,000 people who already owned a home. The Treasury Inspector General found nearly $8 million in credits went to more than 1,000 prison inmates, and about $98 million to 13,400 taxpayers who never even bought homes. Oh, we have the wonderful looking out for you federal government administering this program, and now some want that government to take over health care. What could go wrong? Next story. For more than a decade, government investigators have exposed an epidemic of prison inmates illegally receiving tens of millions of dollars in tax refunds. Last year alone, more than 250,000 prisoners filed tax returns with the IRS, and nearly 50,000 claimed more than $130 million in refunds. Again, no offense, Jack. Without bothering to report wage information. According to the Treasury Inspector General, government audits have long exposed the perpetual problem over the years, and the IRS has failed to act. As far back as 2005, the Treasury watchdog ordered the IRS to stop the millions of dollars in fraudulent refunds paid to prisoners. That year, a probe determined that refund fraud committed by prisoners increased at an alarming rate of 318% from the previous year, and that the crisis had been well documented for a decade. Here's a sobering story about government welfare programs, how they have increased exponentially, and massive duplication of these programs cost taxpayers a bundle, and increases those people on federal payrolls, because we have to hire people to administer these programs and run them so efficiently. All the links are underneath the video. Check them out at your leisure. According to a recent GAO report, 20 agencies operating 56 programs dedicated to financial literacy. GAO and agencies can't estimate what they cost. The federal government runs 80 economic development programs at 4 agencies at a cost of $6.5 billion. The Department of Transportation spends $58 billion on 100 programs run by 5 agencies with 6,000 employees that haven't evolved since 1956. 15 federal agencies administer more than 30 food-related laws. At least 5 departments, 8 agencies, and more than 24 presidential appointees oversee $6.48 billion related to bioterrorism. That's Rube Goldberg for you. The GAO estimates that eliminating these duplicate programs and streamlining the bureaucracy would save taxpayers $100 billion. That's a chunk of change. Maybe. The way Bush and Obama did spend, and are spending, I don't know anymore. But what could go wrong when you surrender your liberty to the federal government and allow it to take care of you? The U.S. Medicare program improperly spent more than $3 million in 2007 and 2008 to buy Pfizer Incorporated's Viagra and other erectile dysfunction drugs for senior citizens. Government investigators said the purchases violated a 2005 ban on covering the drugs under the U.S. health program for the elderly and disabled. Medicare administrators blamed the spending on a software error and said they would try to recover payments to private insurers who administer the program's drug plans. Medicare should not have covered these drugs. George Reeb, acting Deputy Inspector General for Audit Services at the U.S. Department of Health and Human Services, wrote in a report released in March. He recommended that Medicare work with the FDA to maintain a list of prohibited drugs. Medicare administrators, in a response to the report, rejected the suggestion as unnecessary. And the coup de grace, the Center for Medicare and Medicaid Services, the federal health care agency that is a key bureaucracy in key bureaucracy in implementing Obamacare, made at least $70.5 billion in improper payments last year alone. $70.5 billion in improper payments last year alone. These improper federal health care payments amounted to more than the combined total of $68.3 billion spent by the entire Homeland Security and State Departments last year, which spent $44.5 billion and $23.8 billion respectively, according to the OMB. Medicare made at least $48 billion in improper payments in fiscal 2010, and Medicaid made $22.5 billion, according to written testimony on Medicare and Medicaid fraud, waste, and abuse presented to the Senate Subcommittee on Federal Financial Management by Kathleen King, Director of Healthcare for the GAO. Again, I am not stumping for an end to the federal government, simply pointing out that it is an uber inefficient machine. It can't even fulfill its current responsibilities, many of which are unconstitutional. Yet liberals want it to take over healthcare. If this weren't such a serious matter, I would laugh. Have a nice day.